Well, welcome everyone. Thanks for coming to our second group of presentations for the fall 2018 term. My name is James and we're coming to you from the McMaster Health Forum at McMaster University. So welcome. An agenda for today's presentations. I will give you a quick rundown of the McMaster Health Forum, our current Queen Elizabeth Scholarship Program, our new scholarship program, and then I'll turn it over to our presenters. We have three groups of presenters. The first two are outgoing scholars. The first group of three went to Malaysia. The second scholar went to England. And then we have a special guest, our first incoming scholar from our new scholarship program, who's visiting us from Colombia. And we will end things off with a question and answer session. So the McMaster Health Forum is a leading hub for improving health outcomes through collective problem solving. We aim to harness information, convene stakeholders, and prepare action-oriented leaders, and act as an agent of change by empowering stakeholders. The Queen Elizabeth Scholarship Program is run by a partnership between the Rita Hall Foundation, Community Foundations of Canada, Universities Canada, and individual Canadian universities. The purpose of the program is to activate dynamic community of young global leaders across the Commonwealth to create lasting impacts both at home and abroad through cross-cultural exchanges encompassing international education, discovery and inquiry, and professional experiences. The version of the Queen Elizabeth Scholarship program that's offered here at the McMaster Health Forum is called Strengthening Health Systems. Our scholars will contribute to strengthening health systems and become part of our large and growing network of health system leaders. We have been honored to receive a second Queen Elizabeth Scholarship Program, which is just starting. Applications are in full swing for 2019. We are one of 20 Canadian institutions to host this next round of scholars in the scholarship program, and will run from 2018 through to the end of 2021. This new program is called the Queen Elizabeth Scholarship Program in Strengthening Health and Social Systems. So we see there's a slight change in our focus. This new program is very similar to the one that is just ending. There are some differences that I'll just note very quickly. The location of the internships is expanded. So the old program was all Commonwealth countries. We are now able to expand that to include low and middle income countries as well. Our partners, because of that, have changed. So we now have partnerships in Colombia and Lebanon with other potential ones on the horizon. And the focus of those internships has changed slightly to include social systems along with health systems. And because of this, our eligible programs have changed. So all of the same graduate programs are still eligible, but we have added the arts and science program at the undergraduate level. And the number of opportunities has changed. So by the end of the program that's currently ending, we will have hosted or sent abroad 61 scholars. In this new program, we will only be hosting or sending abroad 24 scholars. So you see there's quite a difference in the number of scholarships that we are able to offer. Speaking of that old program, we divided them into three different cohorts. This first cohort primarily went away or visited us in 2016. We had a good mix of incoming scholars, and outgoing interns. Our second group was the largest group. This cohort primarily went away or visited us in 2017. You see that was a large group of scholars that went abroad during the summer of 2017. And our presenters today, at least the first four of them, are part of this cohort. This is the cohort that primarily went away in the summer that's just passed in 2018. We also hosted a large incoming scholar contingent during the summer of 2018. And we currently have 5 scholars who are abroad as we do this presentation. Next presenter is comes with many firsts and extraordinary. So not only is she the first scholar from our new scholarship program in Strengthening Health and Social Systems, she is also the first scholar from a non-Commonwealth country to visit the forum, and she's the first scholar from Colombia to visit the forum. So welcome Alex to the McMaster Health Forum. She's actually coming to the end of her time with us. So this is why we cornered her to get her presentation done before she heads back home to Colombia. She's participated in different research and development projects focused on community empowerment for the improvement of access to healthcare services of displaced populations and the strengthening of the primary healthcare strategy. Alex has been learning while she's here at the forum how to incorporate the Latin American Health Research Database, or LILACS, into our own health systems evidence database here at the forum. So it's a great pleasure to introduce you to Alex, and I'll turn it over to you.
Well, I'm really glad being presenting after you guys after the first scholars, because this will give us a different perspective, so the focus of our internships were pretty different. Thank you very much, James, for the presentation, and and thank you everybody for being here today and the people who's joining us online. So first, an outline of how it's going to be this presentation. I'm going to give you a little bit of context. We'll talk a little bit about my university and my personal background, because it all makes sense of why I ended up being here in Canada. Second, we will go for some information, and I will talk to you about how is the whole process of the internship. And to finish, I will talk about some insights and reflections and some questions I have after having this wonderful experience here in Canada. So to begin with, I'm a Colombian student. Colombia is, world known for coffee and emeralds, and we have an amazing variety of flowers and birds and animals, but also we do not have such nice fame for the armed conflict that has been going on in the country for the last decades. Even though it has been a conflict, like an internal conflict that has been affecting the peripheral areas of the country, not the main cities specifically, it has shaped a lot of how it has been our cultural, social, and political history and how it is right now. And even though we just recently signed a peace agreement with some of the guerrillas that were the armed groups that were causing the major part of the conflict in Colombia in 2016, and we are in a post-conflict age right now for saying something, we still have so many challenges to face in order of the dynamics that are coming through this new process period for our country. So, okay. I'm sorry if it sounds a little bit weird now. Second, I live in Medellín, which I'm not actually from Medellín. I'm from Bogotá, which is the capital city of Colombia, but I've lived 15 years of my life in Medellín, so I pretty much consider myself as a paisa, which is the way we call the people that lives there. Medellín is the second biggest city in Colombia. It is well known for being the city of the eternal spring. We have a wonderful weather. We have a lot of cultural diversity, but we also had late 80s, the beginning of the 90s, an internal conflict that derived of the whole drug dealing process and this whole thing that I'm pretty sure you're all aware of. Even though this was by the end of the 80s and the beginning of the 90s, and the city has changed so much since then, and our mayors and different governors and political leaders have invested a lot in transforming the city. Well, we have now some dynamics that are product of that history that happened in the 90s, which is specific for our displaced population. We in Medellín have the second biggest group of displaced population from Colombia, so it is important that we have that in mind. And going through my university. So University of Antioquia is a public university. It's the second biggest university of a public funding in Antioquia, which is the department that Medellín is in. And the picture in the left side, it's an overview of the campus, and in the right side, I don't think I'm just confused, it's other way. It's the building of the medical school. As James told you before, I'm a medical student. Last year, for us, we don't do a bachelor program. We just finish and go straight to university. So we finish high school and start university. It's 6.5 years for med school. And specifically, our program is strongly focused and it's strongly oriented to clinical content. And even though our university is very well known for being in touch with the social context and proposing different social projects. Our program itself, it was, and it is still a little bit, focused too much into the clinical contents. So from 2014 till now, the School of Medicine of the university began a process to try to incorporate the primary healthcare strategy as the axis of the whole medical program. So this was an initiative that was led by the Public Health and Preventive Medicine Department, and basically it was the reason why this happened is because we started wondering about what was the real role of a doctor in our socio-political context. So since 2014 until now, the department has established different practice territories within 5 different neighborhoods and territories, 3 of them neighborhoods in Medellín, and 2 of them different small towns or cities that are within our same department. And they have been focused on working with community empowerment and social determination of health. So, to go a little bit about my background, again, last year medical student, already told you that. Been working since 2013 till 2018 with FISIS research group as a research assistant, going through research in vascular muscle physiology. This sounds very different for the focus that I was telling you about, but I mention it because this whole training gave me a lot of experience about doing systematic reviews and about going through the literature and about managing information while doing research. So also from 2013 to 2015 and again from 2017 till now, I've been coordinating the primary healthcare study group. It's a group that has professors, students of different schools, not only medicine school, as well as nursery school, dentistry, psychology. We try to incorporate as much diversity as we can. And the study group pretty much try to focus on how to implement the primary healthcare strategy into the training of the health professionals and as well into projects for communities that actually led to giving them installed capacity and not only interventions that are short in time. 2016, I had the opportunity of doing a winter course with Harvard University, focused on post-conflict and public health. And well, now I'm here with you since July the 4th, doing this internship at the health firm, thanks to the Queen Elizabeth Scholarship and the ELAB Scholarship. And so these pictures are because even though I already told you a little bit about my background, being part of the study group for primary healthcare and working with communities has been a fundamental thing for my training as I will say as a doctor, which I will become almost in a month, but also as a health professional. This have been fundamental for me because it have gave me different experiences, different perspectives. And so in one of the pictures, you can see some of the students of the group working in a community garden we have. So this is a neighborhood called La Cruz, which is in the mountains of Medellín. And what we aim to do with this population is, it was first try to connect with them, understanding a little bit of their context. So this population is a neighborhood that grew on the peripheral area of the city, pretty much because of displaced people that came to the city after like the time of conflict that I told you about in the early 90s. So now the neighborhood has a lot of diversity, but many of the families that live there have been in contact or involved in this problematic. They have been displaced from their original places. And so you can see this behind the kids showing the hands. There's a community library that has been established thanks to the work of some community leaders, which we try to work with in order to improve empowerment of the community in health issues. And well, this is another picture of the whole group in our meetings. Right now we're focusing on growing this community garden and trying to make it a space for conversation about health, for giving a new meaning to wellness and health, trying to take it away a little bit of sickness and hospitals and doctors, and thinking about it from the perspective of social determination of health. So after this whole story, how did I end up here, going from working with this community in Medellin to being working at the firm? Well, in 2013, we had in Colombia a new health system reform that was like a proposal, but because we were facing a crisis in our health system, so this all gave us a lot of different context and perspectives from what were the needs of the country right away. So we were wondering, how do we reach the stakeholders level, since we are working with communities and we are so community focused, and how do we make that more productive and more effective? And so in 2016, I take a course with Dr. Daniel Patiño. He's a former student of the PhD program of health policy here at McMaster. And so I had an introduction of health policy analysis, and so he was the one that showed me told me about the forum work and about all the different perspectives that I could get from having an internship here. So I asked myself, what can I learn from the Canadian methodology to approach, analyze, and understand the decision-making process in health? So this question is pretty much the one that motivated the whole internship. So going specifically to the work that I've been doing since July, one of the strategies that a health firm has for making informed decisions, for helping the process of decision-making at the stakeholder level, it's the health system evidence, which provide easy access and organized access to different evidence about health policies and different issues. So I was asked to go through LILACs, which is the Latin American and the Caribbean database. This was created by the government of Brazil initially in the 80s, and now it grew. And this is a database that contains and harvests articles, publications, and research from all over Latin America and the Caribbean. And this slide, which is a little bit messy, is that taxonomy that is used in the health firm to actually classify that evidence. So what I had to do was going through the LILAC's database and try to identify relevant evidence for the health system evidence database, and then apply this taxonomy to classify it, whether if it was talking about governance or financial arrangements or delivery or health professionals. Well, I won't get too much into the detail because I think you already know about this one. So this is a brief summary of how was the process. First, we had to understand how LILACs worked. Since it's a database, well, I had to develop different search strategies to try to navigate it and to be sure that we will retrieve the proper information that we were wanted and that we were interested in. Then we had to be sure that we will have a systematization of the process in order to be reproduced once I went back to Colombia. The fourth step was harvesting and classifying the evidence, and the last one was applying the coding and the taxonomy that was developed by the health firm, which is the process I'm still in. It's a long process, but we're there and we're learning a lot of it. And as an extra part of my internship, I was allowed to participate in 2 courses from the PhD Health Policy program. One of them was with Professor Julia Abelson, the Health Policy Analysis course, and the other one was with Professor Michael Wilson, the doctoral seminar. And this was very interesting because as a doctor, as a medical student, I've been trained in a different kind of thinking. It's a very strict, like, it's all about clinical practice guidelines. It's all about making decisions in the patient context. So this kind of was going out of my comfort zone a little bit. So it was challenging, and I learned a lot. But it was amazing. So now for finishing the presentation, some insights, reflections, and some questions of the whole process. What have I learned from of it? What am I bringing home back with me, and what are the challenges ahead? So some insights, and this is very general, but it's something that has been it's something that has come to me in different scenarios while I've been doing the internship. And the first thing is that the context is always different, but the approach needs to have a structure. So even though we have different contexts for, I don't know, Colombia is way much different than Canada, or even in Canada we have different provinces, and it's like population is way much different within each province. It is necessary to have a defined structure to approach the health needs of those populations. And it is important that the whole team, like the research group, or even though if it's at the level of the government or the stakeholders, have that structure very clear. Also, it was a little bit overwhelming because I knew about the Canadian health system, but of course I wasn't trained in that specific context. So for me, it was a lot of new information, a lot of new things to learn and to understand. So this was something that actually Professor Mike told us in class. It's not about how much you know about everything, because if you go to the broader scope of it, it's a lot to know about, but as long as you understand the framework you are using to approach that information or that dynamic, you are in the right track. You're doing well. So don't be overwhelmed. And also, this is another reflection that is, I think it's can be applied to our different experiences. It's that as a scholars, we have a responsibility with choosing what are we researching about. Sometimes, and it's even if we have been trained in that community setting, when we get into our university research and our programs and our projects, we get biased about what are we going to do or what are we going to research about, and it's always important to understand the reason why. Why are we doing the things that we are doing? Is it because we have a lot of information regarding that specific issue and it's not something that is relevant for society or relevant for a specific health issue? So it's something that we have to question ourselves very often. And so the last one, insight, is pretty much that. All you do must always have a purpose, even if small things, and even if it's just going to a seminar or going to a talk. I had the experience of being in two of CHEPA seminars, and I had also the experience of share with different scholars and different people. So what I learned of that was that every opportunity is, or every new person I met or every new class I was going to, it was a new opportunity to create ideas and to make and to propose solutions to the different problems that I was interested in. And some reflections of how networks are so important in the health sector, how the work needs to be articulated. Sorry for that, it's missing an S. And this is important because sometimes, and I've always questioned myself on how much researchers, scholars, we work in a synchronized way with government and with stakeholders, and how the work we do as researchers is so relevant, but how are we taking away that responsibility of the government or of the stakeholders? And what I mean with this is that it's very important to be aware of that, being aware of how important it is to do proper management of the information and to understand that there's different levels to interact with this. And so what's next? Just to finish, I've been thinking about how in my university, and specifically not in the medical school, but in the public health school of my university, we act as advisors for different stakeholders, and we get a lot of, we've asked in different levels to bring some advice and recommendations for policy making. So how we should better articulate all that work that has been done before and think about our university as a platform, maybe trying to think about something as a health firm for a future. And for me, for Colombian medical students, it is mandatory for us to do a rural year once we've finished. So I'm thinking about how, well, so for giving you a little bit more context, the rural year is doing clinical practice full year, but in a little town or a city that's not one of the main cities, and a city that, or a town that has maybe some access barriers to healthcare. So I'm seeing this as an opportunity for articulation to be able to address health issues and health problems in the community I'm going to work with, more from the perspective of the policy making and what are the opportunities for policy making in that specific territory, and not only from the approaching of the community, which is the thing I have had experience with before. And so this little picture, which is I'm so sorry because I didn't put this picture of Hamilton, but I'm totally in love with Hamilton. I'm in love of Hamilton sunsets. It has been amazing. I've made so many friends. People have been great. I've had the opportunity of going to the beach actually during this last summer more times than I actually did in Colombia, which is really funny. So I've been more times in a lake, beach that I've been into my own country, but so, well, that's really funny. And well, yeah, that's pretty much it. Thank you very much. That's my email if you like, I don't know, more information about or any of the projects I told you about that I work with back in my home university. And thank you to Queen Elizabeth, and thank you to the Health Forum. And well, if you have any questions.